Hello, and welcome to another edition, Season 2, Episode 3 of Sharpe Takes. We're going to diverge a bit from public education, which we've focused on for the last number of episodes. And I am delighted today to have as my guest former legislator, Diane Lanpher, with whom I served for a number of years in the legislature. She was her last stint was as chair of the Appropriations Committee, so has a pretty good understanding of the budgetary issues at the legislature. Now she's on the staff of the Green Mountain Care Board, and as we have noted in news outlets recently, that the legislature did some significant things in the last session around healthcare. And despite that, I think we still have some big problems in terms of cost for citizens paying for their health insurance. So I am delighted to have as my guest Representative Diane Lanpher. Thank you for being here, Diane.
Well, thank you for having me. It's a delight to always be able to have an opportunity to come back and chat with you.
Yeah, so what's happening with healthcare?
Well, I'd like to say what's not happening with healthcare at the moment, but there's so much happening at the same time, which is why it's really kind of tough to keep track of things. So thank you for I do work as the Director of Legislative Affairs for the Green Mountain Care Board, which allows me to bring the history of my time in the legislature and the experience of bills moving to an entity within state government that to their efforts, they work very, very, very hard and way often with like many of the state employees. Matter of fact, most of them do such an incredible job. But the linkage to the building and how a bill moves and when you have to come in and testify. So I've had to be that fulcrum between the two, and it's been an absolute delight to be able to continue to serve Vermont in that manner. Prior to being elected, I actually worked at the Vermont Department of Health at ADAP, and
Right, I recall that.
yes, you were there. I think back then I moved a bill or helped move a bill that limits your ability to be able to purchase Sudafed over the counter without signing.
Yes, that's right.
So I'm very proud of some of the work both I've done outside and inside the legislature. So what's happening is really what you really want to know. From my world, there's what is the Green Mountain Care Board responsible for, and then I can maybe help to bring in some of the stakeholders and the entities around it that are all working together. And you know what's interesting today? Did you know that today, I just realized that this morning, this is the anniversary. It's 1 year ago today that the Oliver Wyman report came out. On September 18th.
Save $400 million or something like
that
that.
was
Healthcare.
that is you're right. That was a study that was done on the reference-based pricing is really encouraged.
And my understanding is that the legislature moved forward with reference-based pricing in this past session.
Yes, it's
That's
part
pretty
of a big.
exciting.
It is very exciting. So part of my coming in January, needing to learn a lot of new things, really stretching my brains. But I was tracking and keeping track of 9 particular bills, and one of them in S-126, which is now signed into law. At the end of the session, the 9 bills that I was tracking, monitoring, and helping to arrange for the testimony, all 9 of them were signed.
Oh, fantastic.
And that was, I had never seen anything so pretty. But
and some people say some of that happened because everybody's focus was on education, so these bills sort of moved rather nicely through the legislature.
I had told people that sometimes because we could see the crisis. A year ago today, we got the Oliver Wyman report, which was a report that the legislature had commissioned to go forth in 2022 to go and get a handle on what is happening with healthcare and the cost and the system as a whole. And they spent 18 months with this hired contractor to go out and do all that investigating, looking under the hoods of every hospital and what's happening. And his report was quite shocking. And if you recall, at that moment a year ago, it was described as at least of the 14 hospitals, 9 were in the red and 5 of them severely in the red, predicting that they may not be around in 3 to 5 years.
And despite that, we also heard that the insurance company was on the brink of bankruptcy as well.
And just in time for the legislative session to start, that was also happening, that our largest in-house carrier, Blue Cross and Blue Shield, had been going through some fiscal issues, which I could go on a whole show for just that. But in the fall, they had, last fall at about this same time, had a association with Michigan Blue Cross and borrowed $30 million to keep them in solvent, and with the relationship, because it's the Department of Finance and Regulation that monitors their solvency as an insurer, and that put them back in a good place. That was in the fall, but by January, the good work of that and the amount of claims that were coming in at the end of last year was putting them again in jeopardy. So the hospital situation was incredibly intense, but by January, February, it became very clear that the insurer was now even in a more hot situation and needed to be addressed. So where all of that happened, things moved in the legislature. You saw in the last year, when you think about what's happening, the Agency of Human Services, AHS, and the Secretary Samuelson and team, after the Oliver Wyman report now, has the task of picking up on the next level of transformation. So that is in their work to do, which means they're holding meetings, they're looking at regionalization, looking at what should be where, keeping in mind the overarching everything that everybody's looking at right now is the affordability issue driving this. We know, we saw it happen in real time. We know what's happened in school budgets because of health insurance. We knew that it drove up property taxes, it drove up costs in businesses, municipalities, the state government, because they're all self-insured. There was a $40 million extra because of the amount of cost in the health insurance for the state to come up with. So it impacts everything. So when you say it's like it's everywhere but nowhere at the same time.
Yeah.
That the issue around education was very front and center, as is the housing, as it should be, because it is critical. So when it wasn't, healthcare was a crisis, but known to many, but maybe not as known out of the building. But everybody who really knew what needed to happen was involved. So I can honestly say, between the governor's office, the Secretary of Human Services, Owen Foster, who's chair of the Green Mountain Care Board, does yeoman's work. As a matter of fact, he's on today on Vermont Edition at noon. The Department of Finance and Regulation and the hospital entities have, we don't always agree on everything, but we're pretty much in total agreement. The affordability is an issue, the crisis of access and being able to get health care. And then, of course, you know what happened when the feds passed a particular bill down in Washington that is now coming to light as to the impacts that's going to have this next year. So what happened in the legislature last year that I believe is, not only do I believe, I can see, I'm watching it in real time, which is an absolute delight for watching your work. In several of the bills, the legislature really stepped up and was brave enough to step out on some of the things that were not comfortable for all of the hospitals or the entities around providing Green Mountain Care Board with more authority, when a lot of people think we should have less authority, because we're the regulator. I don't think anybody really loves the regulator that much, but they shouldn't be. But gave us more authority around responding to the insurance issue if insurance carriers should become at that level insolvent. Gives us emergency powers to be able to lower prices at hospitals right away without something else happening. So that is pretty dramatic.
And maybe people are beginning to recognize how important regulation is in our economy,
Right.
uh, as a part of keeping things stable and affordable.
So New York does not have a regulator on their healthcare system like Vermont does, which is why we just recently, seeing the amount of funding, we have the UVM Health Network is not an entity that provides actual health care, but it does own the parent company of 3 hospitals in New York and 3 hospitals in Vermont, which Porter here is one, Central Vermont Medical Center, and UVM Medical Center are the 3 hospitals in Vermont, and they have 3 hospitals in New York. What we're in the midst of uncovering in a lot of the work in the last year and a half as seeing in the finances where a lot of the Vermont hospital is funding the
Yeah,
New York
that's what I
hospitals.
heard. Yeah.
And so
Vermont taxpayers are end up paying for New York healthcare.
we're adamant, meaning the Green Mountain Care Board, and I believe everybody on board, is that Vermont ratepayers
Yeah.
should not be paying or subsidizing the New York hospitals.
Right.
And that has been a strong position around the affordability issue. That happened here just last Friday. The Green Mountain Care Board itself, of the 5 members, voted to make some pretty dramatic steps around the medical center. Everyone wants our medical center, our flagship academic, to flourish. What was a difficult, maybe not difficult, but in the weeds of negotiating or finding a needle in the haystack around being able to keep Vermont ratepayers' money in Vermont and not going to New York. Not to say that anybody dislikes the New York hospitals. We access it, but they don't have the type of regulation and oversight that Vermont does. And it is, I think, most Vermonters want their regulator to be looking out for their best interest.
Yeah, of course.
And in this case, so it's a long story, but that happened. Other things that happened in the legislature that was really good.
So wait a
Okay.
minute, just to clarify, does this mean that going forward there's going to be less or no money going from the UVM system over to New York State because of the work of the Green Mountain Care Board? Is that my understanding?
We will keep an eye on that.
Yeah.
There's an observer there now, if you remember Mike Smith from his days. All
Yeah.
right, so he's now been, one of the other bills allows us to, when, for circumstances, the Green Mountain Care Board can assign an observer embedded in to watch the finances and what's going on.
Yeah.
They're not running the business, they're not taking things over, but they can be looking deeper. Green Mountain Care Board has about 30 staff and about 3 or 4 with about billions of dollars in hospital work that they don't have the ability to get to that level. And so having somebody in the circumstances like that in there is very helpful. So I can't say that we're keeping an eye, but efforts and in the orders have not been written yet. So passed, but on the 12th of September, the orders will be out October 1. So it would be a little premature for me to say that because it's still in work. It's
see.
still in work. But the reference-based pricing you referred to is going to take a couple years,
Yeah.
but that has got some very promising efforts to keep down costs. Everything that everybody's doing is to help to keep down costs. The other bill that immediately made a big difference this year was H 266, which is Act 55. And in that bill, that was a simple bill, like they all are, that was to help to monitor the 340B plan, which is a whole nother prescription drug plan. But by the end of the session, the second part of that bill did something instantaneously dropped. Vermont was paying the highest cost for a group of drugs that are, a lot of them are cancer treatment, infusion pieces, but a whole class of drugs. We were the highest paying consumers of those drugs in the country.
That's
And
what I heard. Yeah.
yes.
And this chopped that down
We
to
went from,
size, so
we
to
chopped
speak.
it down. I shouldn't go. It went from the highest to the absolute lowest in one bill. Moved the average sales price, the ASP, to you cannot charge more than 120% of the average sales price. And
That's
some of them were at 6,000% or something.
yes,
Astronomical.
yeah,
All right, so that proved to go when Blue Cross and Blue Shield puts in their filing for rates, which is in May. And this bill hadn't been signed, but for none of the other work, they had figured between what they were going to have for claims, what they were going to have for their work was going to be for the individual in the QHP, because that's the only Green Mountain Care Board doesn't do all the others. We do that.
yeah.
We do the rates for those two. The individual and the small group, Blue Cross and Blue Shield came in at 23.5% on the individual increase.
Right.
On top of the pasts were double digits.
Right.
Astronomical. With this bill, it went from, well, the predicting piece of it is the numbers went from 23.5 down to 15.1.
Yeah.
Just because of the good work that the legislature had done in that one jump. Work with the Green Mountain Care Board, going through some other things, was able to, when they made their announcement on August 22nd, that rate went from 23 to 15 down to 9.6.
I read that in the newspaper, and
Still
that's primarily because of the work on the prescription drugs.
Right. And then the other layer, other things that we found, there was about 4 or 5 things that the Green Mountain Care Board worked on to get it from 15 down to 9.
So to help people understand, this means that less revenue is going into the hospital, which had a $90 million surplus. So their surplus or their revenue is going to be substantially reduced because of this. And then Blue Cross Blue Shield is paying substantially less
Yes.
to the hospital,
Yes.
so that the cost to ratepayers, people who are buying insurance from Blue Cross Blue Shield, is going to be less than double digits, which is still high,
It's still high.
but certainly a lot better than 23%.
Right. And so I would it's not going to be like your insurance is going to be this. There's going to be a lot of other factors. But this is where entities from Green Mountain Care Board, the Department of Finance and Regulation, in a very rare move, this, I think it was August 14th, they issued an order that Blue Cross and Blue Shield or MVP cannot negotiate with the hospitals at any more of an increase than what they had from FY25. So they have stepped into their regulatory realm heartily.
And that has something to do with the reference-based pricing. In other words, the cost across the board in terms of percentage over Medicare, or is that what we're talking about?
You're getting close to there. So right now, the Green Mountain Care Board in the bill 126, which is a very large bill and has many good things about it, many things. One of them is established and ordered the Green Mountain Care Board, or you shall go forth and establish this. It's going to probably take us 2 years. They're going to have to look at it and figure out how to implement this.
But in the meantime, in a more direct way, the Department of Regulation, what's it called? The Department?
Department of Finance and Regulation, DFR.
Thank you.
Yes.
Is putting the clamps on what the charges are going to be.
Because their regulatory oversight is on the solvency issues that your government has in place regulations to ensure that that when you're purchasing this insurance, that this company is going to be around and has the ability to be able to pay the claims.
Right.
So that is their oversight, and so their number one concern is around the solvency. Green Mountain Care Board has maybe the unenviable place of not only the affordability for ratepayers, but we also have a responsibility to the hospitals and the communities to make sure that there's access, quality, that it's there. And that is a real fine line between Sometimes the tension
Yeah.
between those two can be, and they can conflict.
So let's look at that for a minute. So we had the UVM hospital was doing quite well, had a big surplus, but this report showed, this report showed that 9 other hospitals were in pretty tough shape.
Yes.
And 5 of them were in extremely tough
Yes.
shape. So these changes in this bill and other actions of the Green Mountain Care Board, how is that affecting those hospitals
Yeah.
out in the rural parts of Vermont that are struggling financially?
So you are absolutely right. It's balancing that whole piece. Working with the hospitals. So out of the 14 hospitals this year that submitted their budgets submit to us by July 1 is their due date. And then this past Friday, they present them, there's deliberation. Of the 14 hospitals, 8 of them have gone through as submitted. But you've got to give them credit as part of the stakeholders in this whole possible scenario, as our guidance that the Green Mountain Care Board put out, much like if you remember the budgets for the governors, no more than 3%. And it was going to be very hard for hospitals, particularly the ones that you were just speaking of, to come in at that level of increase because everything else, as you know,
Going up.
went up. And so, like the FQHCs, which is a federal piece, not ours, a lot of clinics, it's the cost of healthcare.
Yeah.
It is so ironic that is so hard for them to meet as well. Working with them, AHS in the transformation realm, working with them and meeting with them with some contractors to get to a point where they could come in, worked. So 8 of the hospitals, all of their budgets passed just here without as submitted because they did the good work. We have right now
And they're going to move out of the red, do you think, because of that?
that well. There's many of them that it's the finance piece is going to be a little tighter, and it's going to be time will tell. It's hard for the community. We want to make sure that maybe some regionalization, and this is going to sound very familiar to you. There's a rhyming that's happening in the education world that's the same in this world. And some of the people that have been working on in the education changes or regionalization, I said we should be holding hands with healthcare on this, because the transformation work is what does every community want to have access to, that every place needs to have,
Yeah.
then what should be at a regional level that everybody could have at a regional level, and then what is it that's at a state level at our medical place that we don't need to have, heart transplant everywhere. That is the other one, could be either in Burlington or in Boston. So they're working that part out. So like I started off with a year ago today, when in showing all the hospitals their situation, we're not picking on them. We want to look at it as a system, and it's hard to kind of sometimes knock down the barriers between what some people might think is competing,
Yeah.
and we want to look at it as a system. And so maybe realizing your piece of the system should maybe change to look like this is a hard thing for them to go through.
And the Green Mountain Care Board has the power to direct this,
No.
or is only suggesting this?
No, Green Mountain Care Board does not have anything to do with that. The Agency of Human Services is working on the transformation work.
I see.
So back to that bill, is a part of that bill not only directs us to come up with the reference-based pricing part of it, but also put into place a statewide plan for healthcare. All right, so that's the Agency of Human Services is not only working transformation, but has 2 years to come up with stakeholders, so that as a regulator, it would be very helpful if we had a plan, like an energy plan,
Yeah.
to be able to, when somebody says, we would like to do this, that we could reference a plan that said it's in line with, or it's not. So we're getting to that point. That might be a little bit, but
Well,
that's all work that's happening.
It's really interesting that you bring up energy plan, because we have an energy plan that we're not following. And so what good is it if we, spend a lot of money and effort and negotiating and all the
Yep.
work that needs to be done to come up with a plan if we're not going to pay any attention to it?
That
Who can
is true.
enforce this plan?
Right. Who can enforce it? The Green Mountain Care Board has a certain level of regulatory enforcement, and so does DFR, and so I would imagine would be the Public Utilities Commission around energy thing. Sometimes I have witnessed, as you and I have been around a long time, when enforcement meets, you know, community and resistance, it's um, it can be weakened,
Yeah, could be tough.
can be tough,
Yeah,
and then it gets very, to lack of a better word, political,
yeah.
right? And that
And part of this whole thing is transportation in my eye.
mhm,
So if we look at historical, whether it's education or healthcare or many things,
mhm,
going to the grocery store, it used to be that every little town center had its store and it had its school
yes,
and it had its medical practice and because transportation was an issue, and you
mhm,
didn't. If you had a problem in Bristol that required a doctor, and you can't go to a doctor right in Bristol,
mhm,
you're in trouble.
yeah,
These days, however, with the rescue squads that we have and just cars, and you can get in a car and you can drive from my home, you can drive to Porter or UVM Hospital and get there in within a half hour.
mhm. Even Elizabethtown in New York is even closer than Burlington for us
Yeah,
here in Addison County.
and so this because transportation is so much
Mhm,
easier, it makes I'll say distant healthcare facilities much more accessible because you can get in your car and
mhm.
just go there.
On one hand,
You're
it's
not in a horse and buggy anymore.
right.
Um,
On one hand, we have that, and then on the other hand, it's an issue, a real issue for people who don't have that ability and or to get there in time. So in the report, Oliver Wyman's report, it won't surprise you that one of the top 5 issues that they came up was housing, because of staff being able to, in housing was an issue, and transportation was number 2 around,
yeah,
and access to primary care. So our focus as a statewide, not just Green Mountain Care, but I think this is well known, is a focus on more primary care opportunities everywhere. As
which is a bill, as I understand, didn't go very far. You talked earlier about what didn't get done.
what didn't get done.
I know people in Addison County were advocating for universal primary care, and
Mhm.
that didn't go anywhere. Is that right?
Yeah, it did not go anywhere this election, but I feel the energy even around a lot of the good work that happened this year and a lot of the other bills around supporting primary care. And there is right now an effort, there's an application that Vermont, the state of Vermont, AHS is right now writing that would help with some rural health transformation that would help a great deal with this. I mean, I think some of us are a little cynical about whether or not Vermont's going to succeed in receiving that grant, but I think we definitely should and are applying for it
Yeah.
to see. And
That's a grant I just read in the paper yesterday or something. That's
the rural health,
yeah, that's
yes,
a
yes,
big amount of money out of the federal government, out of CMS,
yes.
that may come. We've applied for. We,
Well,
meaning the state, has
yes,
applied for,
yeah.
and may come to the state. So we only have a couple minutes
Okay.
left. Maybe we'll have to have you back because this is a huge subject and there's a lot we have not covered. I just wanted to touch base just for a second because there's people are fearful, and
Yeah.
we read in the paper about Medicaid cuts and SNAP cuts coming out of the
Hmm.
federal government. Do you or does the Green Mountain Care Board have any handle on this? And if so, what are we going to do as a state with regard to what, 45,000 Vermonters or something like that are going to
Yeah.
lose Medicaid coverage or something like that?
And I don't think it's going to be all at once, but Green Mountain Care Board, as well as with stakeholders, talk about and trying to get a handle on what did it do, what's at stake. We also work with or in communication with our federal delegation as well, that to see what's going to move. I'm anxious to see what passes in this next budget, which is in the next couple of weeks down in DC. Is there opportunities? I think everybody would like to see the subsidies part of the healthcare piece. What I do know is that an estimate on that would be like $63 million to backfill if we were to, as a state, to be able to help with that, as well as many other things. So right now, people are looking to see what's happening and when is it going to happen, because some of it is now and some of it doesn't happen for another year or two. So to prepare for whatever that is. So as you would imagine, I'm going to take the first thing first, what's coming first,
Yeah.
and get a handle on its actual impact into Vermont, and how can or should we as a state react to it.
Long term. Yeah.
React to it. And right now, finances for the state, wearing my kind of like my previous hat, they're okay, but they're nowhere near as flush as they had been during COVID and other times. So the dollars that the state does put out there is going to have to be very, very strategically placed.
Right. So thank you very much for joining us today, Diane
You're welcome.
Lanpher, staff member of the Green Mountain Care Board, and I'm glad that you enjoy your new job, because it's a big responsibility and a big problem that we have
Yeah.
going forward for healthcare in Vermont. So thank you very much for your work.
You're welcome.
And thank you for listening to us. I want to just put a pitch in. Middlebury Community TV and Neat TV here in Bristol are sponsoring this program. And we would very much like to hear what topics you'd like to hear, or what guests you'd like me to have on the show. I intend to keep this going for a while and help the public understand the problems that our state faces, and what role we have in solving those problems. So please let us know what you'd like to hear on this show. Thank you very much for joining us, and check in for more episodes of Sharpe Takes.
Clear. Yay!
Want to be a guest on Sharpe Takes? Have an opinion you want Dave to hear about? Email davesharpe@gmavt.net.